Hello, Dr. Anjana. Welcome.
Hi, how are you going?
Very, very well. Thanks for coming on and having a chat to us. I feel like you're going to have a hell of a lot of wisdom to be able to share with the community here. So I really appreciate it. I
My,
wanted to I wanted to have a little bit of a chat with you. First of all, I wanted to discuss what it was. Um, that brought you to the medical field, and also how you've kind of navigated your way into the integrative medical field, which I find incredibly interesting.
yeah, so I think what sparked my interest in medicine was probably started with my dad. My father is a GP in Melbourne, and he's been practicing for the past 30 years. So I think I sort of hold him up there as a bit of a hero, and that inspired me. I think from the time I was a couple of years old, I wanted to be a doctor, and I was aiming for that. I think as I went through hospital medicine, I saw a lot of chronic illness, and I felt that a lot of this could be prevented with the right lifestyle and dietary interventions. And that's what sparked my interest into integrative medicine. I felt like that was what I could really offer my patients, is that sort of coaching around that. And so that's why I started the Masters in Entrepreneurship with you. And
Yes.
I looked at, I guess, how I design, I guess, a clinic around that, and what that would look like,
Mm.
and what sort of innovation I could bring to that area. And then I went on to do a fellowship in nutritional and environmental medicine after my 3-year general practice specializing.
Mm.
So it's been a long journey. It's probably been, about a 15-year journey of getting to that point, and getting mentored and into, I guess, my specialty areas of chronic fatigue and fibromyalgia and
Mm.
complex gut conditions. So that's what I guess, that's my special interest areas, and I really enjoy treating them and getting people better.
It's amazing and it's fascinating because, well, as you mentioned, we've probably, our origins of our relationship together was probably about 13 years ago, where we studied a Masters of Business Entrepreneurship together. And it's been a while between drinks, and you've done and
Yeah.
accomplished so much on a personal level, professionally since then. But I'm fascinated to explore a little bit more about what this integrative medicine looks like. And from what I understand, you've delved into nutritional medicine as well as environmental medicine. Do you want to explain exactly what that means, and how you found these two factors to really like assist people in getting over illness?
Yeah, I think there's probably like a misconception out there that integrative medicine, is pretty much sort of hippie medicine, but it's not. It sort of embraces the conventional medicine, so that's one half, and the other half is, I guess, looking at diet, lifestyle, and environment.
Mm-hmm.
And looking at other ways of treating, so understanding things like herbs, vitamins, minerals, and how that interplays with health. And do we need to go on a long-term medication, or can we potentially prevent this whole thing or lessen the symptoms with other lifestyle interventions? So that's a really important misconception. We are foundationally conventional doctors, and we can prescribe and we do all the same things, but we have this added, I guess, toolbox.
Mm-hmm.
Um, in terms of, with diet and in terms of how it interplays with conditions, I guess it's looking at, say, if someone presenting with fatigue and going, well, what lifestyle factors are contributing? How are they sleeping? What are they doing at night time? Do they need some help to sleep to get their circadian rhythm back on? And then what is their lifestyle like? Are they in a bit of burnout? Do we need to support them with some herbal adaptogens to get their energy up and working right, so that their circadian rhythm is operating normally? So I think it's looking at that, as opposed to going, they're fatigued, they're depressed, here's an antidepressant.
Yeah,
Um,
great.
and stay on that for the rest of your life. So I think it's trying to see if we can correct the imbalance, and then, you know, hopefully not need any intervention at all, whether that be pharmaceuticals to minerals. Like maybe you don't need anything and you can just use those healthy lifestyle interventions to stay well. Yeah.
Yeah, it sounds like you have just a greater breadth in your toolbox than otherwise, which is great. You know, you touched on you touched on chronic fatigue and I suppose sleep and quality of sleep as well.
Yeah.
That's something that I am fascinated by, and I try to delve into a little bit in my own research. I'd love to talk a little bit about how you found, what practices you found to be able to get greater quality sleep, because what I've found personally is it's not just the length and duration of sleep, but it's the quality and the practices that you do prior to sleep to be able to get that quality sleep.
Absolutely. I think we were just talking earlier about renovations. And so as we've renovated the houses, one of the big things that we put in was sort of warm lighting, and really trying to reduce that sort of white, stark light in the house. And that's one important step. And the other things, I guess, is having a nighttime routine and not falling into that second wind. When you get that second wind of energy and you're like, oh, I'm going to stay up. And then that also reinforces in a bad circadian rhythm. So when you're starting to feel those yawns coming, wind down, get into bed, read a book. Try and obviously avoid the laptop, but hey, I've got a toddler. I've got like a window of 8 to 9 where it's my time. And yeah, I'd like to watch a bit of Netflix. So I just actually brought this in. I've got my blue blocking, light blocking glasses, and that's really helpful. I find I don't have a problem with sleep latency or just falling asleep when I wear them. They're really helpful to be able to watch something or do your work or be on your phone. They suggest like after 6, but usually, you know, I usually put them on. We've got warm lights in the house anyway, so I put them on if I'm on my computer or watching TV after 7:30. So that's helpful, and I don't find it affects my sleep as much. So yeah, that's some of the simple things that I do.
Yeah, no, that's great. That's really awesome. A couple of questions about that. The quality of lights that you've been putting, that you're going to be installing in your house. You say that they're a more kind of subtle form of lighting than that stark white light. Are there any?
I can't remember the name, but it's just a warm orange light that we put in. Maybe I can find out what it was that we actually put in and let you know later, so you can put. But yeah, we got an electrician. We got a electrician that was certified with the building biology college, and so he came in and wired our house and put in the right things for sleep, even including reducing, I guess, EMF and things within the rooms, and so that was really helpful. Yeah,
that's awesome. I'd love to get those details from you as
well.
Yeah, sure.
If you don't mind, that was really good. So you can get like a master switch into the bedroom, so it switches off the circuit to your bedrooms at nighttime, which is nice. Yeah.
Sorry, you broke up there for one moment.
Oh, sorry. You can get a master switch for your bedrooms, which switches off the circuitry at night. So that's great. Yeah.
Unbelievable. Do you so that switches off the master switch, and I'm assuming that obviously turns off the Wi-Fi and anything really that's going to be emitting EMFs.
Yeah, into the bedroom. So and then you can leave obviously your kitchen and, you know, other circuits going. So it's just mainly for sleep. Yeah, just to not have any interference.
I'm getting those details. What do you like? Have you experimented with software that you can put on your actual computer itself?
Yeah, there's one called Flux that I use. Personally, I didn't find it work for me.
Yep.
I found I really needed the glasses. I found otherwise, even with Flux, it would take me about an hour to fall asleep, whereas normally it's like 15 minutes. So I found the glasses actually the most useful.
Yeah, fantastic.
Mm.
Any other practices that you can think of off the top of your head that can help for a more restful night's sleep?
I guess with the consultation of a doctor, if you're having issues getting to circadian rhythm, then a nice thing is melatonin, and you can get that from the pharmacy, the circadian, through a script, and that can help to reset your sleep cycle. And I think it's just having that sleep hygiene, really, isn't it? So, not having any lights or computers, devices in the room, and sticking to that routine. I think when your body gets into habit, it starts to wind down. And I think like conflicting things, and some people do say exercising at night is okay. Otherwise, exercising more in the morning, and allowing your body to wind down. And obviously exercise is also really good for getting good sleep. Yeah.
Well, I suppose putting that body under a healthy amount of stress is going to allow it to have that time to recover, which is going to be very productive for sleep as well. Which I want to take a step back about this sleep practice and actually talk about, you talk about circadian rhythms. I'd love to actually break down exactly why being in sync with your circadian rhythm is so beneficial for a restful night's sleep and a productive day, week, and life ahead.
Yeah, I think so. As we sleep, our body repairs. Okay, it repairs, it heals, it detoxifies. So when we're eating into that time, and I usually tell my patients the hours before midnight are gold. So if you are trying to do your 12, go to bed at 12 and then you sleep until 9, it's not the same recovery as doing a 9:30 and waking up at 7. It's a different, it's a different level of, I think, healing. And because I've had patients go, I get 9 hours, I go to bed at 11:30, but they're not recovered. And you really need to clock in those hours before midnight. And if it's impractical, then what I do tell patients as well is to, on the weekends, you really need to focus on that, or you allot 3 or 4 days out of the 7 that you focus on sleep, and you get those early hours in, and they do thank me for it when they start to get those hours before midnight. It really makes a big difference to that recovery in the morning and having good energy levels in the morning. It's repair. Yeah, so if you're not repairing, you're going to sleep debt, and you got to pay it back some way. It's not a interest-free loan. It's a loan, and you're going to have to pay that loan back in some way or form. And that might be in burnout, and then that takes a lot. I guess in the stages of recovery, or in illness, you've got sort of the burnout phase, which is quite easy to fix, and then you go into the chronic fatigue states, and they're much harder to rebound from.
I suppose the longer you build up that debt, the longer it might take to be able to, the longer it accumulates and the longer it does take to repay it.
And it manifests as, recurrent viral infections and all those sort of things. Your immune system starts to break down, and your battery in your body starts to break down a little bit as well. Yeah.
It's incredible. And I find it particularly fascinating when you were touching on, having sleep before midnight versus having sleep after midnight, how the body can really sync up with your external environment and, be connected to the earth, which makes sense. Your body understands the connection to the earth, and how certain, throughout let's call it an 8-hour sleep cycle, from between the hours of 10 and 12, there may be a concentration on your mind and your body on hormonal replenishment versus
absolutely
later on in the sleep cycle.
Absolutely. And interesting that, so with Chinese medicine, they actually have a body clock, and it goes through the different hours and what organs are actually moving through in that 2-hour window. So you're absolutely right. I think there are focuses of the body on different points. So you are cutting out that part, I think, when you're sleeping at midnight.
It's unbelievably fascinating. So you've touched on Chinese medicine, Ayurvedic medicine, and you've really kind of tapped into a few different aspects of, I suppose, study when it comes to combining everything into
Yeah, I mean,
what it
I guess I'm innately a curious person, so I
is.
do like to understand. And if I see something is working, you know, I want to understand how and why and what's their philosophy. And I think as a practitioner, I think that's just my philosophy, is that openness
Mm,
um, to learning and understanding. And yeah, TCM medicine is a beautiful form of practice. I love, you know, I go get acupuncture and with my patients often with a management plan, it's integrated with other practitioners.
mm.
So yeah.
I love it. I want to touch on, and I want to bring the conversation to the context of parenthood and, in particular, fatherhood, because this group really is
Yeah.
about being able to guide dads to live a more impactful life for themselves and their families. And I'm really interested in, well, first, the difference between women and men when it comes to their biology, and how different practices could actually impact them on a meaningful level.
Yeah.
Would you be able to kind of touch on that in
Yeah.
terms? Yeah, go ahead.
I mean, like, I guess yeah, mainly from a hormonal level, I can speak to men are very lucky. They have regular pulses every day of testosterone. So you get that pulse happening every 19 minutes. And that's why men, I would say, emotionally, probably a bit more stable over the month. Whereas women, I remember there being a joke about when you marry a woman, there's like 28 different personalities. And that's because every day there's obviously a different amount of hormones that they're
Mm,
dealing with fluxes. So there's that biological difference.
mm-hmm,
It's often much easier to recover a male than it is a female, potentially because there is an added complexity of females and their hormones.
mm-hmm,
You know, they obviously go through pregnancy, and there's that depletion that happens from that in of itself. There's a physical depletion, which I guess men don't have to do, but I guess postpartum, you know, men obviously hands-on and up with their kids and doing all that. And I think seeing that in my own partner, there can be a bit of a burnout from that, because they're going to work and then they're coming in and helping at home, and then getting sleep interruptions. And yeah, so that can be yeah, he definitely went through a burnout period with that. It was quite exhausting.
mm-hmm.
So I don't know if that sort of answers your questions,
No,
or
no, it definitely does, and this is something that we've talked about a lot in the group. And it's about there's less of a biological dependency on a father when your child is born, but obviously there's a lot that the father of a newborn is required to do. And there's also, there seems to be biological shifts that take place as well. Dads know, will put on weight, significant amount of weight
yeah, I heard that.
during
Yeah.
during pregnancy of their partner, and then often the weight might come off after pregnancy for the
Yeah.
mother, but the dad tends to continue to do so. And there's stress related factors. There's also a well-known aspect of depression that takes place with fatherhood after children are born as well. So
And adjustments as well, I think. I mean, to the family dynamic, you're going from 2 to 3, and there's a little one that pretty much rocks everyone's world, takes over basically. And so I guess finding your rhythm in your relationship as well is really, important. It's a big adjustment period, especially I think with that first one. And just I guess with women having C-sections, the husband's got to like hold the space for that and help your wife recover, your partner recover from that. And not all births are, simple. So people can be sick post it, like I was. And it was about 3 or 4 months of my husband holding the space for both my daughter and I, and working. So it's a lot.
It's definitely, and talk about, sleep deprivation and deficits versus, accumulating interest from a loan, that's going to really take its toll. So I suppose once everything's said and done, it's about self-care and actually being able to repay that interest slowly in a
and that's what you're really good at. So I think coaching, coaching men to get things back on track. So that's really important, because I think what I've noticed, I guess, in my practice is that women do have more of a tendency to focus on their health and want to repair. Whereas, I mean, even with my own husband, it's hard for him to put himself first and prioritize his own well-being. But I guess as you prioritize your own well-being, you actually prioritize your family in the long term.
And it's so hard, you touch on such a poignant point for so many dads, because we're not used to, whether it's within our biological makeup, you talk about the different makeup between women and men, and women being a little bit more emotional at times, biologically. Would it be fair to say that?
Yeah, I think we are. I'll be honest.
Okay.
But I think it all comes from, we're probably depleted, and I think it probably comes from that as well. So the hormones, and you need to have a good battery on board for everything to work properly. And I think that whole postnatal depletion issue plays a role in that. But yes, I think we are probably more emotional beings.
And on the flip side of that, I think men are inherently less likely to feel vulnerability, or at least allow themselves to put that vulnerability into the forefront. And hence,
absolutely,
the next step is that self-nourishment, which they probably don't allow them to do. And I know for me, myself, when my wife gave birth, it was really just about all hands on deck doing, as opposed to feeling and holding the space and taking that step back to be able to say, hang on, you're no good to anyone unless you are actually feeling good within yourself.
Absolutely. And I think that's really, really, really a really important point, is looking after yourself in the long term. It will just pay dividends, because men are known, I guess, even with the statistics, is that, they don't take care of us. And that's why they get those sudden, heart attacks and things like that, because they're not looking after themselves. And there's so much stress that they're holding and not processing or balancing. Women are more likely to, I guess, seek help. But it is really important to do it, because as you've been through fatherhood, your first year of having a baby, the sleep debt does cause, it can cause depression and anxiety in of itself,
Yes.
So you don't have to have, any emotional things going on. It's just the lack of sleep can make you, affect your mood.
I couldn't agree more. And it's just about acknowledging it and just taking that time, taking a step back and acknowledging it and seeking support, whether that's from a friend, from a professional, to be able to assist, hold the space, and to work slowly, gently to a brighter space, so you can help out those around.
And I think what my husband found helps is also getting time out. Go to the, have a date, go to the footy or go to the cricket. Go out and disconnect for a bit from the family. It's it is an intense time, that especially that first 1 or 2 years. So and that goes to both the wife and the husband, allowing both of you guys, I guess, really to disconnect and time out.
Yeah, spot on. Like just identifying with what you identified with as being a man prior to this whole family thing came on board. I think that individual balance is a beautiful thing. Look, I'm so aware of time, Dr. Anjana, so I'm just going to take a moment to thank you and really
for having me.
I know you've got to head off and see patients. Speaking of which, I'd love to just, kind of understand where you're at and where you work from. And if anybody, feels like they need a little bit of extra guidance, where can they find you?
Yeah, so I work at NIM Clinic in Hawthorn, which is the National Integrative Clinic in Melbourne.
Yeah.
And then I work at Bowen Doctors in Bowen. So
Great.
yeah, so if you're running into any burnout issues, then sure, make an appointment and we can work through that.
Amazing. So those of you who live in Melbourne, I apologize to our international peeps, but do you do online consults by any chance?
Yeah, I do at this point. Yeah, I mean, I do. Unfortunately, with Interstate, I do require they come in, twice a year to see me in person. But yeah,
Yes.
I do see a lot of people Interstate as well. Yeah.
Wonderful. Okay, that's awesome. Thank you so much for your time.
All right. Take care.